I'm Lauren Beecher. I'm a physical therapist here at Health and Balance Physical Therapy, and I'm here with Rachel to talk to you about pain. I'll let you go ahead and introduce yourself.
So I am Rachel Wempner. I am also a physical therapist here at Health and Balance Physical Therapy.
Yeah, so as we talk today, feel free to comment with any questions or thoughts as we go along. But I'll have you go ahead and just start off about talking a little bit about the continuing education and further education that you've done just to better understand pain and the science of pain.
Yeah, so earlier this year, I took an 8-week long course specifically concentrating on persistent pain. So people who have had pain longer than that, like 3-month span that we kind of think of as like a normal pain pattern. And with this course, it went into kind of all of the science-based stuff throughout the pain process, but then also how we as physical therapists can have a major role in this and the latest treatment techniques. So I think this is something that a lot of schools touch on nowadays far more than what they used to, but it's still a thing that a lot of us therapists definitely could benefit from learning more about.
Well, and I love that you use the word persistent pain and not chronic pain, because I think that word chronic, it can be a little scary and it can be like this is going to last forever, whereas persistent is more like, okay, this is something that's been bothering me for a long time. It's persisting, it's lasting, but it doesn't sound quite as scary to me.
Exactly. And this course kind of gave us as physical therapists who took it, but also helped us to hopefully give our patients like light at the end of the tunnel, that this isn't something that necessarily means that you're going to have to deal with the rest of your life in this big regard that you might be dealing with currently with pain. So really interesting. Came back to the clinic with a lot of good ideas, and luckily have been able to use them already on some patients. So that's always super rewarding.
Very exciting. So can you tell me just a little bit about the differences between acute pain, pain that's just started, and that persistent pain that seems to be lasting or is lasting longer than that 3-month period?
So yeah, like textbook wise, that's the big differentiating factor is the length. How long have you had pain? And where they kind of get those numbers from is the typical tissue healing process. So if you have a muscle strain or a fracture or something, whatever your problem is, we know how long it in an ideal situation would take to heal those things. So taking that into account, then once you've reached that 3-month threshold, we now classify you as that persistent pain most of the time. So major things that are different besides the length, how long you've had the pain, is really what you experience with that pain. So a lot of times people who have more persistent pain, their pain is way more of a vast area. It is now no longer localized to, okay, I know I hurt my elbow and my elbow hurts here. It's now kind of this whole area really bothers me.
It's kind of like when you sprain your ankle, and at first it's like, okay, just the outside of my ankle hurts once like all of the swelling has gone down and those first couple of days have passed. And then it's like, it kind of all hurts. So now it's bothering up into my leg or down into my foot. It's not just, it's just the outside of my ankle where I sprained it anymore.
Exactly. And there's a couple different reasons. It's because unfortunately what happens with pain and in the brain and stuff is actually the brain changes that will happen, which we'll talk about a little bit. But it's also that, well, yeah, my ankle hurt. Now I'm walking differently. Now I'm doing things differently to try and avoid that pain. And yeah, your hip hurts, your back hurts, all of that stuff. So all of that goes into this kind of persistent pain process. But touching more on the brain changes, one of the biggest things that I hear a lot with patients, and it's super, super unfortunate, is someone has told them along the line that their pain is all in their brain, that it's all in your head. You don't really have this, or however whoever has kind of discussed that with them. And that is super aggravating to me, because once we go down this, yes, it's kind of true. It is all in your brain, but not in the sense that we think.
Right. And I think that that comes from a place of a really good intention of someone trying to explain the changes that are happening in the way that your brain is processing information and giving you feedback. But I know I hear that all the time with people that I work with pelvic pain or abdominal pain, that someone said, well, this is in your head. And they meant that, hopefully they meant that this is the way that your brain is processing things. But we hear that as, oh, I'm making it up, when it's so not true. You do feel this pain. It is very real. And there are just different ways to treat that.
Exactly. So what ultimately happens when you've had pain for a long time is a couple things in the brain. I'll try and simplify it as much as I can, but you have, every part of your body has a map in your brain of that part of your brain is responsible for moving your hand or the sensation in your hand, foot, knee, whatever. So when you've had pain in an area of your body for so long, that actual area in your brain expands. So I kind of tell people, try and think of like an amputee and how they have that phantom limb pain, is that you have that area in your brain that's designated for your foot, let's say, but you no longer have a foot there, but you can still feel it. So that area of your brain starts to kind of morph in different things. Then what also ends up happening, unfortunately, is that your brain actually gets sensitized to pain, or desensitized, unfortunately, is that the smallest of things can cause that pain to trigger. Meaning, there are some people that are so desensitized to pain that I can very lightly graze their skin, and oh my goodness, Rachel,
they like jump off the table.
Yeah, yes. That hurts a lot, and it almost doesn't make sense. Like, how can that hurt so much? But their body is in this panic mode of, I don't want to feel pain, I don't want to have damage, so I'm gonna fire up those signals to make us do anything to prevent any further damage from happening.
Yeah, and I like to think of that as almost the body's way of trying really hard to protect us. Our bodies are so smart that when we had that initial injury or that initial pain, it recognized that signal and that sensation and said, oh, we don't like this. This doesn't feel right. And then your body just starts to respond quicker and quicker and quicker, where maybe, I see this with like C-section scars, or like really old, even like back surgery scars, where even wearing pants or things like that, that that your waistband shouldn't be painful, but it is. And the body's just recognized that sensation as a threat now.
Mm-hmm. Exactly. And then, so in the brain, one of my favorite studies in terms of pain, and specifically how people process pain in their brain, is a study that took a group of individuals and they actually put some heat towards their skin. Same temperature on everyone, same location, and had the person rate, hey, how much pain did that cause you? Was that painful at all? 0 to 10. And with the group of individuals, it ranged from some people rating it a 1 all the way up to a 9. And so then it leads to, why did this person experience the same temperature, same location, and think it's a 9, and this person's like, what's going on here? Nothing's
right. Like that.
There's no problem.
I barely even recognize it.
Exactly. And what they ended up doing is hooking up these people to fMRI, so functional MRI of their brain. So as they put on this heat to these patients, they saw what the brain was actually doing. And the people who experienced more pain were more around those 7, 8, 9s. Their brain was lighting up a lot more. And so it actually shows, like, no, you actually have different things in your brain that are happening. So it's not, you think it's a 9, it's no, your brain is actively telling you this is a threat, this is a problem. And so that goes into it too, of different people's brains process things differently, and it could be you're born that way. It could be you had life experiences that made you that way. We will never know, but the main thing us as physical therapists is we need to take that into account and really just not jump down that rabbit hole of it's all in your brain, let's get over it kind of thing.
So kind of thinking of like, you go to pick up a pencil, you only plan to work so hard. You go to pick up a box that you think that weighs 5 pounds, you don't work very hard, but then it ends up weighing a lot more, or vice versa. You think a box weighs like 40, 50 pounds and it's going to take a lot of effort to lift it, and it ends up being really light. Your body was prepared to work really hard and respond in a really strong way, kind of like the brain is like, okay, I'm just ready for this. I'm really prepared to protect you and keep you safe. And it kind of over responds.
Mm-hmm. Mm-hmm. Yeah, which unfortunately for a lot of us is super unfortunate. Mm-hmm. But there's things in therapy that can definitely help, as we call it, desensitize the brain, desensitize your how the body responds to those stimuli and different things that come along your way throughout the day.
Yeah, so when you're working with someone who has more persistent pain, what types of things are you looking for? What types of questions are you asking versus when someone comes in and says, oh yeah, I stepped funny yesterday or I stepped funny last week and now my knee hurts?
Mm-hmm. So my biggest takeaway with anyone that has persistent pain is you're no longer following like the traditional pain pattern. So your therapy, it's super important that it's super individualized to you. So biggest thing is their evaluation is super important. And quite frankly, with these patients, we're going to spend a lot of time just talking. Mm-hmm. And I know people don't come to therapy to talk or physical therapy to talk. But we are going to spend a lot of time talking because I need to know how high of pain are you dealing with right now? What kind of things flare up your pain? Is it as simple as, walking to the kitchen to grab a glass of water, or is it you're mowing the lawn? How high does that pain get at its worst? How long does that last for you? Are you out of commission for 30 minutes going to sit down? Or are you out of commission for 2 days because you did a simple task? All of those are super important things for me to then, come up with our obviously treatment plan, but also for me to track our progress, because unfortunately with people who've had persistent pain, it's super hard for them to see progress in therapy because it simply takes a long time. I explain to a lot of people, typically the longer you've had pain, the longer therapy is going to last for you, unfortunately. But if I can come at you the next month and say, hey, remember when you would go to the kitchen and that meant that you had to sit down for 30 minutes after? You're now able to wash the dishes for 5 minutes. Like, that's a huge improvement. Where a person might not pick up on that day to day, those little small changes that are happening, but they're just so minute that if I don't get all of that information day one, we could easily just keep saying, yeah, you got a lot of pain, shoot.
Right. Oh yeah. No, I think it's all about putting it in perspective. It's not like I can just flip a light switch on and off. It's not like, okay, today I have pain and now I don't. I can do anything and everything I want to do. It's more like, okay, now I can sit for 10 minutes at the dinner table with my family, whereas before I had to sit in my one comfortable chair and had a hard time feeding myself. It's those like little things of I could do this for 2 minutes and then I was in pain or had more pain for hours versus now I can do it for 5 minutes and it doesn't kind of destroy my entire day.
Exactly. Yeah. So
just getting their story right from the beginning.
Exactly. Getting the person's story. Also, all of those things are super important for our end goals. Some people, their goal goal is just to be able to walk to the mailbox and back, and that's fine. But some people, that's not even where we even start therapy. We're wanting to, be able to work out in the gym for 30 minutes or go on a nice long hike or do whatever it is. And so we need to make sure that we are tailoring our treatment for them as precisely as we can to what you guys want to do. It's not, therapy should not just be you come in and you get a good workout. Who knows why I'm doing these things? It's everything has a reason. And so factoring in all of those things are hopefully what makes you feel a lot better in the long term.
Well, and then I feel like people feel like even though they're coming to therapy for maybe a longer period of time, or there are a lot of little things that they're trying to do throughout their day, they are able to notice some of those changes and those differences because they're doing things or working towards things that they want to do versus something that maybe I think would be a good idea for them, or someone in their life or society says you should be able to do this. They're doing things and working towards things that are valuable to them, which is huge.
Exactly.
Yeah. So besides kind of talking through someone and really learning their story, any other things that you kind of think about or take into consideration?
Obviously we take into consideration just how someone is moving in general. We take into consideration how, as I said, how much, like if a light touch is bothering you a lot, I'm not going to be digging my thumbs into you like crazy. We're going to start very light. The biggest thing I kind of always tell people with what to expect in therapy is it is very individualized. But unfortunately, almost for every patient, we do expect some fluctuations. So those first couple of visits especially are me getting a feel of what we can do. Of, oh crap, on Tuesday we did X, Y, and Z, and yeah, you were really hurting after. Okay, well, let's take a couple steps back. Or Tuesday I left and I don't even feel like we did anything. Oh, I guess we can do more then. So just always kind of waxing and waning what we can do, and making sure that every time you come in, we're doing something that's valuable, but also that isn't going to kill you for 2 days later.
Exactly. Yeah, and I know I like to think about too, what else is going on in somebody else's life. Like I know right now, a lot of people their home environment has changed a lot. Their life situation has changed a lot. So I've had a couple people in the last few weeks who were kind of on that like upward trend of the roller coaster ride that is recovery. And we've had like little setbacks because they received some bad news, or they weren't able to kind of have their normal routine throughout the day. And even that's made a huge difference in talking about like, okay, yeah, no, I did get some bad news, or I heard this, or I had to do that. And it was a setback, and just kind of thinking about not only the physical side of, oh, I didn't get to my exercises as many times this week. That was only one piece of the puzzle.
Exactly. Unfortunately, yeah, our routine, our emotions, psychologically, what we're all going through has a super strong connection with our physical pain. And so obviously, as physical therapists, we are not licensed in, this psychological aspect all the time, but we can definitely take that into account and realize sometimes you do spend more time talking with patients, or coming up with, you kind of take a veer off to the right and come up with, hey, how can we make this easier for you to do at home? Or how can we make this so that you feel this isn't impeding as much, or whatever the case is, because unfortunately it does happen that obviously you can't stop life while you're in therapy.
No, if only we could set up that just like that perfect life environment of just everything, being able to sleep well, being able to eat well, not having all kinds of extra stressors and things that can cause your day to go off course. But we're human beings living lives in a world that can be have a lot of ups and downs, to say the least.
Exactly.
Anything else that kind of comes to mind when you're meeting somebody for the first time or as you move into treatment?
I guess the biggest thing that comes to mind with treatment is, unfortunately, a lot of people who've had persistent pain have received treatment by a lot of people. It can be physical therapists, chiropractors, massage therapists, pain management docs, orthopedics, rheumatologists.
The whole spectrum. You could be the fifth physical therapist that they've seen.
Correct. Which sometimes is a great thing because they've had a great experience with the physical therapist before and they know that it can work. And sometimes it unfortunately is a bad thing because you already have this preconceived thing that therapy didn't work for me. So we do talk about kind of who you're all seeing and how they are helping you. I also try to the best that I can. Some people are easier to contact with than others, but try to keep communication open with the other people you are seeing. Because if we all can get on the same page, I mean, worlds of difference can happen. So making sure that I know what your chiropractor is doing, making sure I know kind of your medication changes, what the agenda is if you plan on getting injections soon, so that we can tailor your physical therapy experience to make sure that we are working cohesively and not inadvertently kind of flaring you up or causing more problems down the line.
That's great. Yeah, and I think especially when someone's been in pain for a long time, chances are you are not the first person that they're working with. They've probably been to at least a handful, if not a couple dozen, other providers and practitioners, which can make even coming to physical therapy such a big barrier because they've been to all of these different appointments and done all of these things, and maybe they noticed a little bit of improvement, but they aren't where they want to be, and spending any more time thinking about this or focusing on it can be really exhausting.
Yeah, and going with that, I would say the one thing that I do highly work towards with my patients is just building that trust with them. And even if it takes an extended period of time, we know as therapists that one of the biggest indicators if someone's going to get better is if they trust you, if they trust in the process, if they trust that you are listening to them. That, I mean, the list goes on and on. If I have a patient who doesn't think that I have best interests in mind or anything like that, you know, I lost them. You're not likely not going to get better, at least with me. So building that rapport. So I know I like to just have a lot of general conversations with a lot of my patients, try and kind of figure out who they are as a person, what makes them tick, because it makes therapy a lot more fun for both of us. But yeah, I mean, but also it builds that that nice interaction and more of we have a relationship instead of I'm just your medical provider and you're my patient.
Well, and I think it's a lot more enjoyable to not only come to therapy, but it's easier to try things that might be a little bit outside of your comfort zone when you know that someone does have your best interest at heart and truly wants you to feel as good as you can possibly feel. Like, it goes a long way.
Exactly.
So any other thoughts or any other resources that you like to share with people?
Yeah, there's a lot of great resources in terms of pain. There are good books that you can buy for pain. One of the main things, there's one video that I do have some patients go home and watch that kind of explains what happens to the body and why you are experiencing this pain, and it's called Tame the Beast. It's on YouTube, so easy. I think it's between 5-10 minutes. It's not very long.
I think it's a pretty short video.
There's a couple other ones. There's what I think is called Understanding Pain Management, which is like a whiteboard draw out of what goes on. But I think education and knowledge is key. The more somebody can understand what's actually going on in their body, the better, they realize why we're doing things that we're doing, B, they can start to pick up on those triggers or those things that, oh yeah, you're right, Rachel did mention that, and I didn't realize that that bothers me. And you can start to kind of go through that yourself and figure out, oh, I don't think that that should bother me, or you get to the point where you are able to help manage yourself, which is the main goal with therapy. My goal for people, as much as I like seeing them all the time, is not to see them forever. I want you to get better. I want you to be able to deal with this on your own. That you don't need me to instruct you through your exercise or dig my hands into you all the time, that you're able to just go about normal life.
Yeah, there are two. One's like a physical book, or you can buy it as an ebook, and the other is a free PDF that I really like because they kind of talk you through a lot of what you were talking about in a very like systematic and structured way. Greg Lehman has a pain science workbook that's online, completely free. It is pretty extensive, but it's worded in a way that's really easy to understand, even if you don't have a strong medical background. Even though I find that a lot of the patients I work with persistent pain know a lot more than I think we sometimes give them credit for. So that workbook is a really nice way to kind of think about some of those things of, oh yeah, doing this shouldn't necessarily be something that's uncomfortable, but it is. Why is that? What are some ways that I can start to reframe my understanding of that sensation or that pain? And then there's another book by Lorimer Moseley and David Butler called Explain Pain that has some really great images and some really great pictures, and is also just, the wording is very friendly to just about anyone out there.
Mm-hmm.
Awesome. Any other thoughts before we kind of give people a chance to ask any burning questions?
No, I think that pretty much, in a very brief sense, covers pain.
Yeah. Awesome. Well, we'll give people just a moment here to ask any questions. But thank you all so much for joining us. We are here in the clinic seeing patients throughout the week as well as online. So if you have any interest in that, feel free to give us a call. Otherwise, I will post some of the links to the resources that Rachel and I talked about. And if you have any other questions or comments or any other thoughts, feel free to send them our way.
Mm-hmm.
Awesome. Well, have a great Friday. Enjoy the sunshine this weekend, and take care.
See you later.